Hi everyone, we're here on the Great Awakening Generator with me, Kirsty Denny, and tonight we have the amazing Melody Stewart with us. And so this is our neurodiversity controversy segment. And tonight we're going to be focusing on PANS and PANDAS. So you might think this is not specifically to do with neurodiversity, but the reason that we're going to talk about it is because there's really a lot of crossover in the symptoms, the traits, the behaviours. And I think, often there are situations where PANS or PANDAS is part of the picture and it can be missed. And it's so important to look at it. So Melody is a naturopath. She's a herbalist. Do we say, is it Buteyko or Buteyko? I never know this.
Buteyko.
Buteyko, almost a Buteyko practitioner. So she's pretty much done that training as well. Importantly, she's a homeschooling mum to 3 beautiful children, one of whom has experienced PANS. And Melody will go into this a lot more because of her personal experience and her expertise. But just for reference, so PANS stands for, it's an accurate acronym, can't even say that part of it, Paediatric Acute-Onset Neuropsychiatric Syndrome. Yeah. And then PANDAS is probably a little bit more widely known, actually. So that's along the same lines, but this is an autoimmune condition that's specifically related to a strep infection. Yeah, so those are really a big mouthful, but they can really wreak havoc on our children. And a lot of the ways that they present look a lot like things like autism, ADHD. And so there becomes this kind of puzzle of, is it one? Is it the other? Is it both? What's underneath any of that anyway? Yeah, so it's a really fascinating thing to look at and also so important. So welcome, Melody. So great to have you here.
First of all, thank you, Kirsty, for asking me and reaching out to me. And yeah, thank you for that lovely introduction. So I am a naturopath medical herbalist and soon to be, just waiting on the final assignment to be marked, Buteyko breathing practitioner, hooray. And also about to head off back to study next year to finish off some nutrition papers so I can become a clinically registered nutritionist. So being a mama to 3, we have 3 beautiful children, 5, 7, those 2 are our girls, and then our eldest is our boy. And he is our child who literally overnight we notice a change, and we often say it's like a light switch. It's like the camera flash going on or the camera flash being turned off. And that's where I'll start, Kirsty, is some of these signs and symptoms that you get are likened to autism. You can have the rage, you can have the OCD. Often it won't be seen when you're out in public. Often it will be behind closed doors, because as we often know in this neurodiversity world is that our children will want to save face. They don't want others to see them like this if it's not normal for them, if they weren't born like this. And so they will save everything up, and then you'll get home to where there's that safe place, safe haven, and all of a sudden the meltdowns will start. And you may there's many videos online. There's even several short movies of families who have contributed in the PANDAS and PANS community where they've filmed their child, and several doctors have explained it is like the child is actually possessed, because nothing can get through to that child at that point in time.
Yeah.
And it is very scary for everyone involved, be it the caregiver, usually the mum or the dad, the siblings, if there's siblings involved, and obviously for the child themselves, because they innately do not want to be like this. And some actually black out. They have no recollection. However, many do. They know what's happened. And then there's the downfall to deal with that.
That's right. And the shame.
And the shame.
Yeah.
And the shame. So in regards to possible triggers, you know, although PANDAS itself is often associated with strep infection, PANS, the greater acronym, can be associated with, you know, many infections, metabolic disorders, and other inflammatory reactions.
Yeah.
I think what else we need to take into consideration is in your environment. So whether that's a trauma that they've also suffered, whether there's environmental molds in the house, you know, whether there's lots of chemical drift from associated in a farming area.
Yeah.
You know, Dr. Gabor Mate, Dr. Bruce Lipton, and Dr. Joe Dispenza talks about that although we have this label for these diseases, and I say dis-ease because it is a dysregulation.
Yeah.
It is not just simply an infection. It's what else is going on for this particular patient to exhibit this then said disease, because you could put another child in the same situation and they may not get this disease. So it's more than just taking a blood test. It's more than just doing various tests to say, okay, well, this child has come back with a positive strep infection, so we can now label this as PANDAS. It's not as simple as that. There's a whole checklist, and I'll read some of them. I'll bring this up on my I've saved it. So Dr. Lila Mason, who is a paediatrician, she was based in New Zealand, but she's back over in Sydney. And, you know, she actually, if I can read from her page, you know, the diagnosis of PANS is based on the child having an abrupt onset of OCD and at least 3 other symptoms. On average, children have 5 out of the following symptoms, and these are 1, anxiety, 2, emotional lability and or depression, 3, irritability, aggression and or severely oppositional behaviours, 4, behavioural developmental regression, 5, deterioration in school performance known as dysgraphia, 6, sensory or motor abnormalities, and 7, somatic signs and symptoms including sleep disturbances, enuresis or urinary frequency. So at the time of our son getting diagnosed, and I say diagnosed in inverted commas because in New Zealand it's actually not recognised.
No, I wondered about that. I thought you could elucidate, yes.
And certain states in Australia it is recognised, but not all. And over in United States of America, we have a similar outcome as well. So our son wasn't at school at the time. However, he went from having close on 300 words to being barely able to actually say mama and dada.
Wow. And can I ask what age this was?
So he was 2 3/4. The anxiety was through the roof. He would often go into bouts of a very deep depression, you could call it. He'd be very, very quiet, very hidden inside. The aggression was very, very scary, through the roof.
Yeah.
The behavioural regression, we had So we had obviously his younger sister. There's just under 2 years between them, and I was pregnant with our third at the time. And we had many people, whether it be family or health practitioners, say, oh, you know, he's just jealous of the baby. He's just jealous of the baby in your tummy, or he's just jealous of his baby sister. And this was the boy who we knew had no jealousy. He would read his sister little books. He would bring me clothes, bring her cloth nappies to me. Mummy, what can I do? What can I do, mummy? It was always, baby sister is doing this. There was never 1 ounce of aggression or jealousy towards this child or towards our third pregnancy. So obviously we can't mark the school performance because he wasn't at school, but yet we can, as a mum being at home and a mum planning to homeschool, I could see that simple task that he was usually able to do of naming shapes and telling us stories, and you starting a sentence and him finishing it, or you starting a story and him adding to that. It became a blank. And we didn't so much have the sensory or motor abnormalities. And the other change that we didn't have was the bedwetting, the nocturnal enuresis. There may have been a slight increase in urination, but nothing to be alarmed at. So of the 7, he was a definite 5 out of the 7.
That's right. And you know, obviously not every child will have the same things or the same number. So you always have to look at that whole picture. And you know, like I've said it before and I'll say it a million times, parents know. So when you know something's off, just don't let yourself be gaslit, you know, fobbed off. When you listen to yourself, you know.
That's exactly right, Kirsty. And this is what I'm a huge advocate for my patients, and also for our son, is that I have fought, because I knew the moment what changed, and I went, this is not right. This is not our boy. Something has happened. And you know, we had the talk of, oh well, you know, maybe it's just, as I said, the jealousy. Maybe he's got autism. There was all these labels given, and I said, no, because in my heart, being his mother, I 100% knew. And probably the hardest thing to accept was that we had no family support. It wasn't so much the medical profession, because I'm very blessed to have wonderful support with some holistic practitioners, integrative doctors, who I'm blessed to call of them are my mentors, but also very good family friends. So I could ring them, I could message them, I could say, well, what do we look at now? But it was the immediate family. And this is what I so often hear. I'm very thankful that my husband was on board.
Yeah.
I was very thankful that we were in a position where he worked exceptionally hard to provide for us. So no matter what it was that I thought, okay, we've got to try this supplement, we've got to go for this specialist, there was no outside family support. And often to the extreme of belittling me as a parent, as a mother, and even as a practitioner. And when you have that, and I hear this so often from my patients who I've been an advocate for and supported them through this, you feel like you are, you know, you really are pushing the proverbial uphill.
Yeah. Yeah, it's such a gift to give someone to really listen to their experience and hear it. And and just take that on board, because as you said earlier, often the worst of the behavior or the scenario, the parents are the only ones who see it.
That's right. That's
And
right,
it's
Kirsty.
exhausting. It's so exhausting.
And, when your parenting styles are brought into question, and you think, okay, well, that's okay. We don't have to see that family member that often. Or you go, that's okay. We'll family doesn't necessarily need to be blood. So we'll join some groups. We'll familiarize ourselves and we'll get involved in the community. And because we were looking at homeschooling at the time, because one, we knew we had a gifted child from very early on, and then we had this neurological disorder, I like to say, versus disease. I thought, well, we'll give this a go. So we immersed ourselves in a few homeschooling groups, and we became quite close with some families, and it was really lovely. And I said to my husband, great, this could be it. And the moment that our son felt safe, he felt he would let his guard down, and sadly, we wouldn't see those people again. We would offer certain, we'd say, let's get together, and there'd always be a reason. And it's it happens once, okay, it happens twice, it happens many times. You go, oh my gosh. And so what ended up happening is we became very insular.
It can be very isolating.
Very, very, very isolating, because you haven't got your family. You're trying to make a new family that you can call upon, and you just keep getting shot down. And what I've come to realize, and what I say to patients, is that you must get support, no matter who it's from. It could be an honorary granny down the road. It could be your neighbour coming to mow your lawns. It could be your neighbour's son saying, hey, here's $10. Can you mow our lawns each week? Because one thing that must present as a united front is the parents. Because what happens is the strain on the parents and the other siblings is just huge.
I hear you. We have a similar scenario, even though we don't have a PANS diagnosis, but we have a lot of the same scenarios and have had them. And we had a lot of times where we barely could even leave the house. And it's incredibly hard. And it's, I feel so strongly about creating ways for parents to support each other, and for people who have been through it and are somewhat out the other side to support others. This is, that's incredibly difficult.
That's right, Kirsty. It's a huge toll. It's a huge toll on the I say the wider family. If people are fortunate enough to have a good family support network around them, it shares that load. I do like to use the word blessing versus burden, because burden is such a heavy word, and I have my faith, and that's something which has got me through. And knowing, remembering that all children are miracles. They are miracles. Our bodies are designed to heal. We're actually made for our bodies to heal. So to remind ourselves that this is a season, this is a moment and a glimpse of someone's life. But I have to say that when you've got a child who's having to be physically restrained because they are harming themselves or others, and you have been up all night, and this is now, day 21 of a flare.
Yeah.
In the pandas and PANS community, we talk in terms of flares.
Yeah.
And
we can circle back to that, but that's about, maybe the trigger brings it back up, right? The symptoms. Yeah.
That's right. And so when you're in that moment, when you're in that flare, and when the first time happens, you think, oh, okay, that's okay. I can get through this. And it might last a few days or a few hours. However, time passes, and you might have a good period, and it might be a month, it might be a week, it might even be several months, and then it happens again. And us humans, we don't forget. And all of a sudden we think, whoa, how am I going to get through today? Because what tomorrow is going to possibly bring.
That's right. It's like it's a bit like a PTSD cycle. And of course, after every episode or flare, you pray that it's the last one. And so then if it arises again, there's that really sinking feeling of, here we are again. And then all that self-talk can come up around failure as a parent as well, potentially, as well as the struggle of it. Yeah. And it's just a lot.
That's right.
It's really a
that
lot.
is it. And especially when you have, especially if you have that outside influence, whether it be family, friends, saying, well, maybe it's your parenting style, maybe it's this, maybe it's that, when deep down that actually, no, this is just the situation. It's got nothing to do with the food, the parenting, the environment. It is simply, this disorder, and it is, one word is hideous. It is absolutely hideous and absolutely exhausting.
Yeah.
And so we could circle back around to the triggers.
The triggers, and then of course we want to look at, what do we do about it? Yeah.
So there's many triggers within the pandas and PANS community. I'm part of a group within New Zealand and Australia, and an overseas one. And if people are new to this condition or disorder, they may not know that diet has a huge impact, as with many conditions and diseases.
Yes.
So one of the first things can actually be reducing that inflammation, reducing that toxic burden that highly processed foods can do to the body, to the system.
Yeah.
So that may be going gluten-free, maybe going dairy-free, trialing those two things out of the diet to start with, taking the processed foods out. So the muesli bars, the packets of chippies that might be in school lunches. Sugar. I think Oprah Winfrey once referred to white sugar and white flour and white rice as white death, the three things, because they're so inflammatory on the body. Now, it's not
inflammatory. It's so addictive. I always think, I kind of joke, but like, oh, I may as well give the kids crack, give them that,
Absolutely. It's actually possibly better for them. Or, we coin the phrase that actually, some of the cereals that are produced is that you may as well feed the child the cardboard box, because there's more nutrition in the cardboard box than what there is actually in the food. And I mean, that's a very sad thing to think, and thinking that crack is possibly less harmful on a person than what sugar is. And you might get laughed at for that, but the thing is that sugar is so inflammatory, and it's not like we're back in grandma's day or great grandma's day where they had their sugar and she might have done some baking, or she might have put a little bit in her tea or the coffee, but that was it. It wasn't in every single
Everything. Yeah,
item
sorry.
and every single meal.
Mm,
And when I worked in the dental industry, the health centre that I was mainly based in, we actually had a chart up on the wall with the little plastic snap lock bags, and in it was, it would have a picture of a food item, and then it would contain this little bag on the outside with actually the teaspoon amount full in it of sugar.
yeah.
And it was a real visual talking point, because patients would walk past for either the dental surgery or for the health centre, and they would say, "Is that true?"
Mm,
And we would say, "Yes, it is." And they would say, "But I give my children all of that each day."
mm,
And they would actually see and realize, well, that's why I'm coming to see you at the dental surgery. That's why I'm having to go and see the doctor for my diabetes. That's why I'm having to take my child for his, all of his neurological conditions, because the inflammation that the sugar is giving you is affecting his brain. So another thing, another trigger can be, obviously, mold is a huge crossover. So that's why I get back to that environment that we're living in. Mold obviously affects the respiratory system hugely. It affects our skin, being our biggest detoxer, and obviously it can affect the brain. So one thing to do is to actually get your home examined. Make sure you have a clean, healthy, dry home, that there's no damp patches, that the kids' rooms aren't actually, there's no mold on the windowsill, there's no mold behind the bed. And sadly, in New Zealand,
especially Auckland, this is big.
Especially in Auckland, we have a very humid environment, in our homes, up until not so long ago, are not built to condition of that environment, and so you have mold. So what we always say is, you get up in the morning, rain, hail or shine, you open up the house, right up, windows, doors, and you let that fresh air in, you let that stagnant air out from the evening, and get your kids outside. Get the kids outside breathing, get them in the bush, get them on a farm, breathing really good, healthy, fresh air. That's something positive that you can do. Other triggers, many families will find that TV, iPads, computers can all overstimulate the brain. And this can be very, very hard for a child with any neurological disorder to process and self-regulate. Some families find computers and iPads an absolute blessing, and in the autistic world, it's been a great aid, because previous children and adults who have been non-verbal have been able to then get computer systems, which they are then able to tell their story. They are able to speak freely using various computer systems, which is absolutely fantastic. However, for a child who is in a flare, adding to that inflammation virus screen in the long run potentially may not be the best idea. So it might be a short-term fix.
That's right. It's so addictive, and it's setting off the dopamine, and if the brain's already inflamed and the system's already stressed, if the child has a need for control because they're feeling so out of control, when you switch that thing off and you say it's time to stop, that's can be like throwing a match into a pile of gasoline. So it is, you have to personalize it for your family, but
it is, we can come back to the sugar and the crack scenario is often that addiction for the screens is like trying to take someone off whether it be cigarettes, whether it be cocaine, whether it be sugar. They
Yeah.
are all addictive items. One thing I thought that we could talk about, Kirsty, was actually some of the symptoms that people may experience, some of the symptoms that families may see. So I went through a list earlier, but in regards to the OCD, it's a specific sudden change where, you know, your child may not, they just would have been happily playing, and then all of a sudden you may see them stacking things in a particular way when you go to pack up toys. They may be helping you do the table and you see them set the table a particular way, and you've never see them do that before. They may go through your drawers and stack those utensils in a very methodical way.
And then, just excuse me interrupting, but often, you know, if it doesn't go right, they'll freak out, right? And it has to be done again. And it does not matter if you're already half an hour late for your appointment or whatever. Like, it has to be like that.
And nothing else can get done in that house until that is perfect in their eyes. And as you say, the appointment that you had, or the school run you had to do, the family outing that you were meant to arrive at, it's gone. That moment has gone.
That's right. And they cannot help it.
No. They often, there is a immediate change in their behavior that they cannot bear to be separated from a particular parent or caregiver. So for parents who are dropping their children off at daycare or kindy or school, this can become a huge task. Unusual behaviours. So people may, or parents may, observe flicking of light switches, so on off, and that's repetitively, and that can be for over half an hour or longer. It's those compulsive movements. It's trying to regulate that brain through these movements. However, these movements are a sign to tell you that something is amiss, something is not normal or correct in that pattern. Often there's a development of tics. So you may see a sudden change in their eye pattern of movement. So blinking continuously.
Like this kind of.
That's it.
Yeah.
Or sometimes it's even a little twitch that happens.
To the side, or
looking to the side. That's it. Throat clearing is often a common tic that can happen. A shoulder shrugging, snorting, or a combination of any of those. We had the throat clearing and the shoulder shrugging. Regression in language or writing, or both. And obviously I mentioned earlier was the bedwetting. So what to do about it? So what do we do about it? So if you notice any of these symptoms with your child, sometimes in a family there can be two children, especially if it's associated with strep. So you would go down the convention. Most people would go down the conventional route, and they would present at their doctor's clinic and say, you know, these are the things that are happening. Excuse me. And sadly, especially in New Zealand, often it's just a phase.
Just a phase. It's transient tics. It's OCD. Yeah.
We get given a whole list of ailments that it can be, and told that it's nothing major, and this will be gone. If you suspect that it is strep, then I highly, highly recommend that you push for a swab to be done, a nasal and throat swab, and for bloods to be done. Obviously, if your child is in a complete flare, getting bloodstain or even a throat swab or nasal swab can be very, very challenging.
Yeah.
Most of the time, the conventional route of treatment for PANS and PANDAS is to do a trial of an anti-inflammatory such as Nurofen, or the doctor may decide to trial a course of steroids. And if there is a remarkable improvement of the symptoms, then that is another tick on their list of, well, this could be possibly PANS, PANDAS, and often it eliminates something else or several other conditions. The second step in the conventional treatment is to obviously stop the infection. So when it's PANDAS, it's associated with strep, but as we know with PANS, it can be other infections. So in our own case, we had a chronic staph infection. It presented after hand, foot, and mouth. So our son had, they call it the sixth childhood disease. And at the start, it was nothing to worry about. And then we suspected it was actually something quite a lot more sinister. And every little spot that seemed to appear would have a pustule attached to it. And it was upon seeing tracking lines that I knew that we were dealing with something which was a lot more serious than just the hand, foot, and mouth. So we treated that holistically, and one course that a lot of people will go down is the antibiotic route, and that can work quite successfully. However, depending on what is the infection and whether or not it is the right antibiotic prescribed for that particular infection. And this is where I think we fall short in our medical system, is that they're trying to cover costs and trying to not overburden the system anymore. And so instead of doing a test to see, well, actually, which bacteria is this, and then prescribe, we're just prescribing blindly. And unfortunately, in these cases with PANS and PANDAS, you then have the child flaring again, and then that's where you'll see the aggression, and the child is away from school again, so then they're missing out on learning, or a carer is having to be involved, or a grandparent, coming to help with other siblings, because simply the house is actually not a safe environment if a child is often in these serious flares. So getting the treatment right is imperative, and that means that you have to be able to see a doctor or a practitioner who is on board and understands this very, very complicated and complex disorder. And that's the hard thing in New Zealand, is there's only a handful of doctors who are up to play with this. Slowly it is getting more understood, and a few more doctors are coming on board. However, their wait times to get in are now increasing.
That's right. And then your family's already in an emergency kind of situation.
We used to be
able. If you're thinking of becoming a functional medicine doctor, please.
That's absolutely right. I mean, in our own situation, we used to be able to ring up and say, we just need even just a phone consultation, because often we couldn't get our child in the car and my husband was away. So even before COVID and the lockdowns, we were doing phone consultations back then.
Before it was cool.
Before it was the done thing, right? So that used to be within a day. Now it's up to 2 weeks.
Right.
And for a family, when you're in a crisis mode, if you ring our health line, unfortunately, you'll get told, well, present to A&E or present to the hospital. With children with this condition, it is actually not a safe thing to take them to an A&E or to an ED department, because how can you physically restrain a child in an environment such as that? And you'll either get someone coming down on the parent, which is a sad situation, that world that we live in, or you know, there will be other complications. You know, the child, it'll be the lighting, it'll be the noise. So that's why it's really important that we have our local GPs, local doctors, who you can get to and have ready access to them without that long time frame. If you are fortunate to have an integrative doctor that you're seeing, or a holistic doctor, and they have done the Nurofen, the steroids, they've done the second step, which is then treating the infection, then the usual, so I guess the third stage would be to potentially put that child or even young adult onto a herbal antimicrobial to look at all of their nutritional panel. So you'd look at their vitamin B, C, D, their zinc, their omegas. NAC, N-acetylcysteine, that's often quite good with the OCD. And obviously it's an anti-inflammatory, as well as being a precursor to glutathione, which is the body's most potent antioxidant. Curcumin has been a great one. Saffron, there's some fabulous studies which are coming out at the moment, and obviously CBD oil as well. There's a few others. There's PEA and LDN, and then finally, if it is a complete flare, your child is non-manageable, and you did go down the route of presenting to hospital and you were able to get a consultation with a neurologist, then you may be fortunate enough to then have a course of IVIG, which intravenous GABA globulin, and that decreases the neurological inflammation. Sadly, in New Zealand, that is very, very hard to get.
I was going to ask about that, so you've answered that question. If
you know what your child has, to try and get into that neurologist who is on board. Unfortunately, there's so many hoops you have to jump through before you get to there, and sadly, many patients are still waiting. I know of some families who have had it and it's been life-changing. I know of some families who have had it and they've had a wonderful week and then that's it. Some families have had many, and I say many rounds of IVIG overseas, because there is no standard or no gold standard treatment for this disease, this disorder. It is a trial and error. It is many variables. And what works for one child, unfortunately, doesn't necessarily work for another. And what works for one family could send the next family's child into a complete fit of rage, and that child become unmanageable.
Yes. And it's just like autism, and then that's what I mean, there's a lot of crossover, and so you need to be really aware that some of these things could be a factor. And because when I look at an autistic child, I'm wondering exactly the same things. Is mold involved? What are they sensitive to in their diet? And all of these things, as you know, are affected by genetic tendencies, which aren't deterministic, but they might make your child a lot more sensitive. Yeah, so it's this whole kind of epigenetic storm of things and this really quite toxic world that we live in.
That's right. And it's whether or not that, as speaking of epigenetics, it's the whole switching on and switching off of genes.
Yeah.
And just because that child may be predisposed to some things, as Dr. Bruce Lipton, speaks of it so fluently, is that given the right environment, those genes can be switched off. Yes. Given the wrong environment, those genes are almost guaranteed to be switched on.
That's right. And there's so many stresses, because there's the environmental stresses, the food and the chemicals and things, and also so many potential emotional stresses. And when you're looking at epigenetics, and Bruce Lipton will talk about this, and Gabor as well, it's coming down through your family line as well. And it's not like you're sentenced to this thing because your grandparents were in the war, but trauma does affect you intergenerationally. And so we have the opportunity to heal it, though, and that's the amazing thing.
That is the amazing thing. And I think that's where we can actually go to, Kirsty, is, so if you've tried all of this, or you suspect that your child has PANS or PANDAS, and you are eating a relatively clean diet, that is, food is thy medicine, as Hippocrates said. So what else can you do? So here's just a few people that you could consider contacting. So having a naturopath on board who understands, of course I'm going to say that. However, just like anything, just like any profession, there's naturopaths who specialize in hormones, there's naturopaths who specialize in men's health, women's health, pediatrics. Within that pediatric bracket, there is only a handful who understand PANS and PANDAS, and only a smaller few who actually take on cases, because it is a very, very demanding field.
Because so interview your practitioner, like ask them questions, don't be embarrassed. Yeah,
that's right. Absolutely. Veto your practitioner, make sure they are the right one for you, and it may take several to actually get the right one for your family. I always like to think that, when I've seen a patient and then they go and see someone else, it's not necessarily because you are not a good practitioner, it's simply that you've helped them to get to the next part of their journey. And this is what I say to my patients all the time. I'm not your forever practitioner, because that I wouldn't be doing my job, because we are designed to heal. So you might be that building block to get them to their next practitioner, who's going to then take them to another level that you couldn't, or you may be there to help them, and actually for them to then become a teacher and help another family. So alongside a naturopath, I think it's imperative to have a good homeopath. A homeopath is going to help you at a different level to a naturopath. Having a GP who is actually supportive and on board and understands your child and your family's needs, and I say family because you aren't just helping that child, it is the whole family. Often there is a need for a specialist GP. A cognitive therapist or a play therapist can be really, really beneficial for the child with the condition, but also for the siblings, because I think it's important that we you know, with any of these neurological conditions, there's so much focus on the child with the disorder. Unfortunately, the other children need that support, that time, that love. And that's why having a cognitive therapist or a play-based therapist, whether it be art therapy or music therapy, can be just so beneficial for the whole family. Often there's you know, an occupational therapist, a psychologist actually for the family, and more so the main caregivers, because if the main caregivers fall down, then there's no one to uphold that family unit, and keeping that family unit as a whole is just so important. I know within the PANS and PANDAS community, the amount of marriage breakups it's horrendous. It's just such a sad statistic, and it really is heartbreaking. Because the monetary strain, if we wanted to go down that route, that's one thing, but just the emotional strain of getting to the end of the day where you have got nothing left to give, because it has been survival mode from the moment you got up to the moment that you've got that child into bed, and to then turn around and give yourself self-love in the sense of, I'm going to make sure I eat today, I'm going to make sure I've had my water, I've had some supplements, I'm going to get some fresh air, going to get some sunshine. A lot of the time the main caregiver puts themselves at the bottom and just focuses on the child, and I know myself, that's what I've done, and I've felt that's what I've needed to do. However, I've got to the point now where I've realized if I don't do something for me, then I'm not going to be there to actually be able to continue to provide that care for my child.
Yeah, that's right. And because sometimes a child might make quite a rapid improvement with some treatments. I think often though, and especially if this is me going on for a while and it's been misdiagnosed and you haven't known, this recovery is more of a marathon than a sprint. So yeah, you do need to pace yourself, try and look after yourself, and try and find joy. It's this like tricky balance with complex needs children, I think, of yes, you love them unconditionally and you accept them just as they are. So it's this balance of finding joy in the moment as much as you can, and then also striving for a situation where they're actually thriving, and so are you.
That's right. That's
it's
exactly
a tough balance,
right.
though. It's hard. Yeah.
It's very, 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 very tough. I think one thing to touch on, Kirsty, is, you know, if parents and families have gone down the route, one, they've been misdiagnosed, and you know, one of the parents or both parents know that is just not the case. They've done a little bit of research themselves, and it's just not sitting right with them. As you said earlier, you know, trust that mama instinct. And I had a fabulous mentor who was a very dear friend. She passed away in 2020. She managed to get to our wedding, and I'd known her since my very early 20s, and I'm now 40 this year. So she had been a dear friend, and she is a fabulous practitioner herself and very well regarded. And in her final years of clinic, she actually said to her patient, she said in the second appointment, she said, I'm not going to lie to you, I'm not going to beat around the bush. You need to put yourself first, you need to put your family first. If your car was broken down and you couldn't afford to fix it, or you needed a new car, you would go out and you would get a loan, no questions asked. So she said, I want you to think about that. This is what it's going to cost to get you right.
Mm.
And here, this is, and she'd hand them the piece of paper. And not everyone has, you know, thousands of dollars sitting in the bank. And unfortunately, children, whether they be on the spectrum or whether they have a any condition, our medical system in New Zealand is lacking grossly. And often I refer to PANS and PANDAS children as the forgotten children, because they're in the too hard basket. Yeah. I know this from the patients and families that I've supported as their advocates. And sadly, I know it from our own personal experience, especially this year, where we had both main hospitals in Auckland turn down our case, even though we had a GP and a specialist GP write 6 years worth of case notes. And they said that this case was not to be heard. I
would so like to say that I'm surprised, but no. No. And unfortunately, I knew, I didn't have great hope that we were going to get this review that we desperately needed, but I did have a glimmer of hope. The reason that I didn't think we would was because I'd been an advocate to so many other families. But I had this glimmer of hope that, well, it won't be us too. It just won't be us. But it was a very humbling experience. A lot of tears involved, Kirsty. Yeah.
And it was very humbling to know that, well, it's happened to us too. So I put on my other hat and I went, well, what can we do about this? And we thought, I contacted my colleagues, I contacted my mentors, I reached out to everyone possible in the integrative holistic field that I knew, even overseas, and I said, this is where we are, what do we do? And I'm very, very blessed and thankful that I have that knowledge, I have those contacts, because I know so many families don't have any idea. And that's why I am going on to do more study. I am still, some days it seems very, very slow. I am still working towards my goal of, you know, getting back into clinic and helping families, because I know the heartbreak. I know it at a personal level of just how absolutely gut-wrenching it can be to not have the money in the bank to pay for that next appointment that you know that your child so desperately needs, and you've had a hospital turn you down and say there's nothing here to be seen. So we went private. We were in the fortunate position to have the funds to do that, and we had investigations done down at Matai Clinic down in Gisborne. They have the most state-of-the-art MRI in the country down there. It's at a private clinic. It's not in any of our hospitals. They're doing amazing research down there. And then we did some other investigations, and although it's crossed off some boxes, it's kept another couple of boxes open for us. We know that now we're dealing with more than just the PANS and PANDAS that we were originally dealing with, and that's what we had suspected for a while. So that's where we are at the moment. But I know for families that who are, you know, their children are in the PANS and PANS community is that making sure you've got that team on board, making sure you've got the support people for the parents, you've got the support for the child, and you don't take no for an answer. If you've got a gut feeling and you know that it's just not right, you just keep pushing. You've just got to keep pushing, because unfortunately, as I said before, and I'll say it again, our medical system is grossly lacking, and these are the forgotten children. They are the children in that too hard basket. You know, that's the elephant in the room that you don't want to deal with, and well, we'll just put them to the side. Unfortunately, though, that's not so easy to do when you're actually living it, breathing it, experiencing it every single day, because you can't just turn a blind eye, because that's where unfortunately injuries happen. And sadly, on, you know, many of these children, as they've gotten older, you know, some have taken their own lives. And there's a documentary on it, and it is probably one of the most heartbreaking documentaries you could ever watch.
Yeah, I believe it. And just a note for parents as well. So if your child already has a diagnosis of, say, autism, it's even more likely that this is going to get swept under the rug, because you'll be told that's just part of that. So you, again, you know your child, you watch out for the changes. And additionally, even though PANS PANDAS is generally seen as an acute onset, the thing is, if it happens really early in a child's life, you may think that's more or less the way they've always been, or it emerges at the kind of typical time that autistic symptoms may come on. So, you know, if you have any feeling like about, you know, after hearing the list of behaviors, just, you know, and you have a feeling about it, just look into it, even if your child's presentation isn't classical, because each person's an individual, of course.
That's right, Kirsty. Just, you know, trust that instinct, and just, you know, reach out. You know, Kirsty, you've got my details. I'm happy for people to contact me and to point them in the right direction. There's great support out there in an online community. We've got some fabulous practitioners in New Zealand, fabulous practitioners overseas. I know a lot of them. One great thing that has come out of the world shabak of the last few years is that more and more overseas practitioners are now doing online. So you are, it's nothing strange to actually go and see a practitioner online who's over in the States, who's over in Germany, who's in Australia. Likewise, many patients contact some of the practitioners in New Zealand from overseas as well, because they have such a good reputation. So it is about getting back to the grassroots, trusting your gut instinct as a parent. When a good thing to end on, Kirsty, is what can you do when money is really, really tight? What can you do when there's no support around? Food is probably, and although food prices are going up, I know, food is one of the biggest things which will always have the impact. So getting the rubbish foods out of your children's diet and getting back to good old-fashioned grassroots food, you know, good protein, good fats, a few carbohydrates in there, and just no processed rubbish.
I
so
totally
just looking
agree.
at the whole food diet.
yes, I'm known for being anally retentive about food, but I'm like, it matters. It really matters.
I think you've
And a lot of
frozen
the
yours at
things that
me,
I say no
Kirsty.
to, I'm like, that's not even a food. It's just, that's not even food. It's, yeah, mystery processed items. So, yeah, yes. So the basics is anything that brings down inflammation, right? Grounding as well. Yeah, bare feet on the earth, and
That's right.
pets are amazing. Yeah. Mm.
Mm.
And yeah, just so much love to everyone who's possibly going through something like this. You've got to have self-compassion and compassion for your children as well. You were frozen, so I just kept talking. Can you hear me now? Hmm.
Yep.
Yep.
Yep. You've
Yeah.
frozen, you've come back now.
Yes. Yeah. Yeah. You went for me
There
as
we
well,
go.
so I just talked for a while and then. Yeah. So yeah, we'll wrap up. But thanks so much for sharing all of that. That was a lot of information, and it's just so important to get it out there. And as Mel said, if you listen to this and you think, oh gosh, that could be relevant for my family, just get in touch with her, get in touch with other people who can help, um, and find support, and just, give yourself so much love as much as you can, because there's light at the end of that tunnel. There really is.
That's
Yeah.
right. That's right. There you have to hold on to hope and know that there is definitely light at the end of the tunnel.
Mm,
Yeah.
awesome.
Thanks so much for having me on tonight, Kirsty. I really appreciate it.
Yeah, thank you also. It's been amazing. Thank you for sharing. Mm. All right. Bye, everyone. See you another time. Who knows? Maybe we'll get Mel back again.